I think Marietta has the advantage of being a small town. You know so many people. You walk down the street and just stop and speak to people. You say hello as you pass somebody. That we're in a lot of cities. You know, nobody speaks as you pass. You just look away and keep going. There's a little different flavor here. I think top to bottom in the health system, there's a lot of pride and a lot of support. There have been lean years when things were a little difficult, but everybody has worked hard, I think, to maintain the quality that we all come to expect when we're in the hospital.
You know, for us, our true north in all of our strategy has always been, we felt as if this community would be best served if we were an independent community hospital for the future. The things that began early on to signal us that there were clouds on the horizon that needed to change our operations were, we were in a relatively small market of about 250,000 people in the region we serve, but we shared it with 4 hospitals. And we knew that in order to be successful in the future, we either had to decide that we were going to be small and focus on very efficient operations, or we needed to grow.
If we did not take action in a time when our volumes were declining and we were having mounting operating losses, I feel like that this organization would have been in significant financial hardship.
We're in an area of relative geographic isolation. We have an aging population who just doesn't travel as well, you know, and so I think that providing that care closer to home has been huge for the community.
To prepare for the next phase of healthcare, we were well aware that we needed to be more productive. So surgery, which is a big revenue driver for the system, it's also a big expense for the system. So we needed to get ahead of the game and think about how can we be more productive. Truly looking at our staffing model, our operations, how we schedule our cases, how we operate on a day-to-day basis, and we partnered with the advisory board to help us.
Administration was contemplating building out 2 more OR suites because the impression of the C-suite was that they were full up in the OR and that they had nowhere to go and they had to build out these $1 million OR suites. In the end, they didn't have to build ORs at that point. They were able to just work with what they have and be more efficient. So they drove down their labor dollars and they were able then to go out and recruit more physicians. So now fast forward 1.5 years later, they have recruited more physicians. They're doing more complex surgeries, and now they're back to talking about having to build out some more ORs, but this time they need more ORs because they're that full.
Patients can now receive care that they haven't been able to receive here in the past. And I live and work in the community, so I hear that. You know, I hear our patients talk about how fortunate they are to be able to remain here and have their neighbors and their friends, because we do see our patients out in the community.
I think the future for Marietta is relatively bright. For us, the challenge for the future will be finding those partnerships like we've had with the advisory board that bring us the missing piece, the things that other systems are doing, the ability to not reinvent the wheel every time, but be able to learn from other people's experiences and apply those lessons here in Marietta, I think gives us the advantages of larger system experiences, but the security that we can plan for healthcare for this community right here in Marietta.